Well, welcome and thank you all for joining us today. And I, for one, am super excited to have this discussion because we have an amazing set of panelists to talk about what exactly does it mean to be one of the marginalized groups in America when it comes to the healthcare system. And so I would like for these amazing people to introduce themselves. So I'm gonna go around the table, and if you just tell us exactly who you are, where you're from, what's your age, and anything you want to include about your life story that leads you here today. So how about we start with Debbie Lee?
Thank you so much for having me. I'm Debbie Lee. I currently live in Nashville, but I'm originally from New York. And I have Crohn's disease, spondylitis, SVT, and PCOS, some conditions that have resulted in me having frequent interactions with the medical community. And I'm just happy for an opportunity to share and spread awareness so that people can get the help that they need.
Thank you, Debbie Lee. I know your story is going to be important to many. And how about you, Rashawn?
What's up, everybody? Rashawn Miller here. I'm a therapist based out of Charlotte, North Carolina. My interactions with the healthcare system has been broad, but it really interacts with the mental health portion. And I know that's something that we don't talk about a lot as people of color, and especially as a Black man. So I'm excited to be here and excited to learn from everyone else.
And I like your shirt. It says, check on your friends, scratch the strong. Exactly, check on me.
Right? Definitely, got to check on everybody.
Check on everyone. And how about you, Cedric?
Hi, everybody. My name is Cedric Pulliam. I'm 31 years old, residing in Atlanta, Georgia, but from Washington, D.C. And I am a Crohn's disease advocate, patient advocate that really fearless and unapologetically shows up in as a Black man, as a queer man, advocating for, access, rights, and equal treatment or equity within treatment, within accessing the healthcare system for IBD patients throughout the nation and throughout the globe. But that's why I'm here and so glad to be here with you all and learn from you all as well. Thank you.
I'm interested to see what you have to think about health equity towards health justice, because that is a key component, especially with the kind of intersections of your life. And yeah. How about you, Tamoria?
Thank you, Dr. Hilton. Nice to meet everyone today. My name is Tamoria McQueen Saba. I am a maternal health patient advocate with a focus on both mental and physical health, particularly in the areas of birth trauma, PTSD, and pregnancy and childbirth complications. I'm a 25-year-old trapped in a 43-year-old body. I don't know how this happened to me. I have two daughters. You can see their pictures in the background. I grew up in Baltimore, Maryland. However, I currently reside just outside of Boston, Massachusetts, and I'm looking forward to a very robust discussion with all of you today.
That's fantastic. And Jessica, I know you have an incredible story to share with us as well.
My name's Jessica, and I'm the mother of a wonderful, wonderful little boy named Seth, who is 5 years old. And I had him when I was 22 weeks pregnant. With a child that's 22 weeks, it's very hard to fight for anything to be done because of the life expectancy. But what makes my case a little different is that there still are industry standards of care. And I was finding out from nursing staff, Black and white nurses, that the standards weren't followed because of the assumption that being a young Black single mother, that I wasn't going to be up for taking care of a kid with special needs.
I want to know, what brings you all here today? As a Black and brown person, as a male or female, as non-binary, straight or gay, what has been your experience with the healthcare system? What ways have you encountered it yourself? And have there been any even issues in childhood that you remember that has really swayed your interactions with the healthcare system in its entirety? How about you, Dr. Pulliam?
So yeah, that's a really good question. I think just from the pandemic, and I formerly was at CDC during the pandemic as a public health advisor, and seeing it firsthand and on the front lines was a very interesting but very scary. And also very uplifting all at the same time, if that's possible, experience. But accessing healthcare over the past year and a half has been interesting, to say the least. I had just moved myself, I just moved to Atlanta in August of 2019. So just right before everything got crazy, was just getting it settled in, and then boom, everything happened. So luckily I finally had administered and found and secured a care team here in Atlanta after leaving DC. But a lot of things were just virtual. And as a person living with an IBD, it's very hard to do virtual or telehealth visits. And so a lot of what I needed wasn't being adhered to during the first 9 months to a year, I would say. So, as a person of color, having a Black GI doctor and, having those tough conversations, like, I really need to be in the office. What can we do? And the alternatives that my doctor was able to, make for me because of the care that I needed. I don't know if I would have gotten that with, a white GI doctor, if they would have understood. I just had so many inequity and disparity issues with my own healthcare access that I don't know if that would have been the same. And so I'm here because of that, like my story, my journey as a patient, and really how my identities, as intersectional as they are, really show up and how they're looked up upon or down upon in this healthcare system.
Right. And you said you work for the CDC. So I'm assuming you have a well-versed knowledge of how this system works. Any of you that's on the screen right now, have you been on the other side of where you're saying, hey, I was supposed to be able to trust this system? Am I just being a patient? I did not know the in and outs of how this system was supposed to work for me, but I can tell you how it failed me.
I think that for me personally, I've had a few experiences where I've been discriminated against. And for me, as a Latina in America, I didn't really, a lot of my family tends to be like, half of my family's light skin and the other half is darker. And so I'm more the darker one. And growing up with my mom, who's lighter, I just wasn't prepared. Like I just saw her experiences and I was like, oh, well, everything should be fine. And then when I was in the emergency room and I was the one being treated, I'm like, how come it's so different? Why is it so different? Why am I having to fight in order to get care versus when I go with, some of my family members that are lighter skin? Why is their experience such a different experience than my own?
Wow. So the issues of colorism, even within the Hispanic community, and we know how that has plagued the African American community. What did you sense that in childhood, right? Were there any childhood experiences that when you were growing up in this field of experience in healthcare system, you say, oh, that's exactly what I felt as a child, or even with your children themselves? Have you noticed anything about them not being seen, heard, or valued?
I don't think as a child, I personally had any awareness. I was super unaware of my surroundings, and I didn't realize in the Hispanic community, there's a big problem of kind of like a suck it up mentality. So a lot of times when you do face illness, there's this idea of like, oh, just get over it. So like, for example, I have Crohn's disease. I had issues in my childhood, but my family just kind of was like, oh, you just have to get over this. Like, it was more like a discipline thing. Like, oh, you have to control yourself. And so I didn't even really see doctors. I wasn't diagnosed with Crohn's disease until I was into my 30s. And when I got that diagnosis, like, oh my gosh, this makes so much sense of so much of my life. Wow. So I think there's a barrier in, Black and brown communities of just like, just avoidance of the healthcare industry as a whole. Like, let's interact as little as possible with healthcare professionals, whether or not that's done, from a place of, oh, something might happen to us, or just from what's been passed down generation to generation.
And Rashawn, do you think that's more of an issue with lack of access versus mistrust versus health literacy as to why there is a hesitancy of persons of color and other marginalized communities seeking healthcare in those childhood ages and delaying therefore diagnosis?
I think it's all of those things, in addition to fear, but then also our own egos that play a role in it. But then and our parents and grandparents, them passing down those things as well, their understanding of what's going on. And let's be real about it. Certain things people of color were considered as test subjects for the medical field, and we are not ignorant to those different facts. So you don't trust that community when it comes down to being able to address those things. And we tend to lean on, whether it be home remedies or like Debbie Lee said, those suck it up mentality, you just push forward. So you don't go to the doctor to get those diagnoses, but then also we're scared about what those diagnoses will mean for our changing in lives.
Right. And Tamoria, I see you have two beautiful daughters that's sitting on either side of your shoulders, right? What do you think needs to change in the system in order for what happened with you to not be repeated in the next generation?
Well, I think that for me, I had a very unique experience in terms of being a person who we don't hear kind of enough about, which is more of the side of someone who was able to have great access to healthcare and able to utilize that in the best way. So what has happened is that there's sort of a media sensationalization over the things that go wrong, but we rarely or never, really think about how many times have you heard, gee, this person survived. We want to talk about all the things that went right so that we can use this as a case model for care. So for me, I have the unique experience of being a person who had great access to healthcare, who also had no pre-existing conditions, who had a healthy pregnancy, but had a 27-hour labor, which resulted in a uterine atony, which is more commonly known as a postpartum hemorrhage. And so you're hearing a lot about that in the last couple of years, birth and pregnancy complications, and in particular, a lot about postpartum hemorrhaging. So what might be important for our conversation is to note that I actually went through 3 physicians during my pregnancy. And it was because the first 2 physicians, I did endure a lot of the feeling dismissed, a lot of microaggressions. And for myself, and this is as an advocate, what I try to help patients with is advocating for myself, but also realizing I have a choice. I can choose better healthcare. I don't think this is how I should be talked to. I don't think this is how my questions should be answered. I think I deserve more time and not feeling rushed. And I got to the point where I said, I was pretty far along actually when I found my third physician, my third OBGYN rather. I was 28 weeks and it was actually hard to find someone at that point. But I found a wonderful OBGYN who took me. And I actually feel like it's because of making that switch that I'm actually alive today. I have zero doubt that if I had stayed with one of the previous physicians that I would be here. And I know that I probably would have died, especially looking at the statistics. And at the time I was actually living just outside of New York City. The prior 2 physicians were really well-known physicians in New York City. And if we look at the maternal health rates today, so I gave birth for the first time 11 years ago. The rates of maternal deaths are actually higher than they were then. So nationally, we always hear this number when it comes to maternal death, that Black women die 3 to 4 times more of birth and pregnancy complications than white women. However, if you look at a place like New York City, that rate almost triples. It goes up to between 8 to 12 times more often, depending on the borough that you're in. And so my focus is now really about encouraging patients, empowering them to not only be what I would call a partner in their healthcare with their physician, but own it. Own it for yourself, understand it. Think about before you go into an appointment, what are your concerns? What are your questions? And if you walk out feeling like you weren't heard, like you weren't seen, you have the ability to change. So I heard that Dr. Hilton, you asked Rashawn earlier, was health literacy a part of all this? And it absolutely is. And he did co-sign that. And that's something that I'm also really focused on because we all speak a different language. Depending on how we grew up with our families, we know we speak one way when mom and grandma are around and our friends than we do, with coworkers and friends and other people. So it's interesting because we also change when we go into a doctor's office too. All of a sudden, that white coat becomes this barrier between so much of who we are outside of that office and who we are once we get in there. And so my focus is really helping people to continue to be themselves and also empower them to gain more knowledge about their bodies. And we have to just make it comfortable to discuss the uncomfortable. I think so much of things that have gone wrong is that a lot of times we don't understand things when we go to the doctor, and we just accept the information that we're receiving. We don't do enough asking, and we just go, oh, okay, well, the doctor said I have this. And we don't push it further and say, well, can you explain that I usually say, can you just give me the dummies version of that, or the layman's terms, or however you want to call it. Because I think there's also sort of a disconnect between physicians are trained one way to speak and to think sometimes and to talk. And we sometimes sit there and go, okay. And then you walk out and go, what just happened here? We also don't do enough in terms of, I think, culturally. So even when I look at the screen and I see four dark-skinned Black African-American people on my screen, none of us have had the same journey, the same life experience. And depending on culturally how we grew up as well, there's going to be barriers to how we want to engage in our care, specifically around both mental health, as we know, which has huge stigmas, as well as physical health. So one of the things that we need to work on collectively as a society is just sort of being able to support people when they do come forward, like those of us who are advocates in this space, and we share our stories publicly. Doing those things helps others be able to talk about it. But once we open the door, we have to invite more and more people in to do that and make it comfortable to discuss a lot of these things. Because again, culturally, a lot of us are taught, oh, don't bring that up. Don't talk about that. You don't want people down the street to know that happened, and there's a lot of, especially if I look at Boston, one of the things I'll tell people is, there's a large Haitian immigrant population here. And so when I'm giving speeches or lectures or doing any form of education, I have to tell people all the time, you cannot compare me, an African-American person who grew up in Baltimore, Maryland, to a person with the same skin tone who grew up in Haiti.
Right. Yeah. And it's one of, you bring up an interesting point. I tell people all the time when you mention the health disparities amongst African-American women, and in general, we know that Black people and Black and brown people, we're not a monolith. We do come with a variety of different life lived experiences. But unfortunately, what we see is that the racial health disparities, they literally are trumped by race, that your socioeconomic status does not necessarily protect you. For instance, what I tell people all the time, my child, as a double board certified anesthesiologist, is twice as likely to die than a white woman with a 4th grade education. That's the truth of the matter. What we know is that Black women, you can have a better BMI, right? Your body weight can be in a normal range. You can have a higher educational attainment. You can live in a quote unquote better zip code with more access, and yet your child will have a likelihood statistically, and you yourself, a worse outcome than a white person with lower socioeconomic status, lower access within their neighborhood to healthcare. And even if they didn't go to their prenatal visits and you did to every single one, you are still more at risk. And we have to talk about what all feeds into that. We have the individual component, the community component, and then what happens within the hospital. And Dr. Pulliam, I would love to hear your thoughts on this, because we know that healthcare disparities and inequities have existed before COVID, right? We know that African Americans have literally higher death rates of 9 of the 15 leading causes of death at younger ages before COVID. We know that COVID, unfortunately, has now shaved 3 years of life expectancy off for Black Americans. And the question is, why, right? What is it that's leading to this? And what are your thoughts surrounding the inequities that we see with COVID-19 in particular in the African-American community versus the overall population?
COVID-19 and its impact on the African-American population, I'm gonna first focus on the region that I was born in and also grew up in and live currently in, that's the South. And as an African-American in the South, North Carolina, Virginia, and now Atlanta, Georgia. DC is included in that as well, quite fortunately. But what I've seen is a definite hesitancy, but not with everyone. One of the things that first comes to my mind, Dr. Hilton, would be, access and knowledge sharing, or knowledge and information, right? During the past year, say, for example, you lived in a very rural setting, regardless of your race, but definitely for African Americans in more rural part of Georgia, things like that, rural health hospitals and clinics, like a massive amount of them closed in 2020. So access and care was basically merely impossible for rural residents in various states, including Mississippi, Louisiana, Texas, Florida, Georgia, you name it, Arizona, and the Midwest. We saw a massive national closure of rural health clinics and rural health hospitals. Funding was gone as well. So that's one aspect of just well, how do I get access and information? Okay, I look at TV. I may still get the actual newspaper at my front door each morning. But during the pandemic, traditional news routes, a lot of them stopped and you had to convert to digital, right? And if you didn't have access to those things, you didn't have the information. I say that and I start with that because that barrier does exist in 2021, right? And it significantly impacted the African-American community because in rural settings in just Georgia, we saw the death rate increase significantly for African Americans. And then nationally, once the data was extrapolated to showcase the disaggregate data for race, you saw a drastic increase of African American deaths due to COVID-related illnesses. And, it was really difficult and hard because a lot of it was information sharing and knowledge, because they were still doing weddings and parties and cookouts and events and things like that, because they were thinking it could have been a knowledge barrier. We don't necessarily have the information from those individuals because some of them unfortunately have passed away, but we saw that high uptick, and our minds is thinking maybe we're just, lack of knowledge and information, because these were very rural parts in Georgia. And, my conversations with people at the state health department, the county health departments was the same. Maybe we just didn't get to them, or they didn't know the seriousness of the matter, right? And I say this to think about the more national space. We have a lot of our own opinions. And so when it comes to the system, and I quote that because I've been a federal government employee for almost 13 and a half years in various capacities, and health for the past 7. Health has been my focus the past 7. And nationally, it's a system. And so African-American, I know my own story, my own lived experience using an I statement. I have experienced negative disparities and very racist aspects from the system, meaning our healthcare system, because it is a part of the larger system, right? And so my own aspects of this is that, you're going to be suspect to the system being what they're telling you, medical information, you name it, because who knows what the validity or the truth that lies within what we're telling you exists. And so that is a personal thing that every single person had to go and, dissect for themselves, whether their decision was to, be serious and quarantine, stay home, don't go to public events, and, visit family through the drive-through celebrations and through the window or something like that. If they have elder family members in nursing homes or facilities and things, it was up to their decision, their personal own decision. And as a, medical professional, all I can do is provide the recommendations and the guidance. I cannot make a decision for someone based off of what I have made my own decision on, right? Yeah. It is been driven in media that the health equity components of COVID-19's response for the American system has been driven by medical mistrust and things in that nature. Those are definitely factors. In my own belief, I don't think that that's just it. I think those are factors that feed into the decision-making process for sure. But, based off of a person's situation in their own experience with healthcare within their location where they live and reside, they may have other factors such as, well, I remember growing up and remembering a hospital where if you went there, you're likely going to die. Like having those kind of rumors for hospitals is like, yeah, you're afraid. So,
Right. And
so
how does your work, how do you think this even shapes, because your life experience, you
Yeah.
have so many intersections, right? You talk, we can talk about race, and we know a spotlight is very much been placed on racial inequities. But what about also involving the LGBTQIA community, right? What are some of the things when you say we have to address the system, what global system structural changes do you feel like are missing in the conversation? And what needs to happen acutely, and then what needs to happen in the long-term setting?
LGBT health is a very, it's taboo in a sense, Dr. Hilton, because you have to think that those medical doctors that got their medical degrees from, say, the 1960s to present, they were not required to have LGBT health or affirming healthcare or any of these aspects that we're trying to entrench and trying to make a part of their system, as whether it's like continuing education credits or certification credits and things like that in that nature. None of those exist in the medical degree curriculum, right? And so all of these specialty doctors or general physicians, whatever, whether they're dermatologists or dentists, you name it, none of them have that extra added unless they made the effort to find it in their medical career and getting their degree. And so that, for one, is an immediate step. You have to think of what curriculum looks like for them to be able to address and affirm their clientele who identify within the LGBTQ plus and two-spirit space. Without that, all of the extra work that we do in public health and with AMA and all of these national and global organizations and associations means nothing.
Right.
Because you continue the same systemic disadvantages and disparities for that community. And this goes the same with race. It's entrenched in the curriculum and what you require of them. A liberal arts school is going to require this. A public school is going to require this. Medical school is going to require this. If you don't add those components to it, you're basically saying that same doctor from 1950 can be the same doctor in 2022.
Right. And we're unfortunately seeing that, right? We see there's studies that show that pain is still not treated in the same way that we saw with the father of gynecology back in the 1800s, right? And so education is one thing, and then accountability tied to it is another thing, because at the end of the day, we have the cost of lives. And it's not only the physical cost of lives, it's also the mental health burden of when you have your grandparents and your parents telling you, don't go to that hospital because you'll die. That's PTSD. And Rashawn, I would love to hear your experience in talking about mental health and the PTSD. I oftentimes say, is PTSD only reserved for soldiers, or do our Black and Brown community, do we not qualify? Because with the repeat trauma, generational trauma, we have to talk about how does that shape you as a human being from the time you were young? How does it tell you and train you? Because the persons who've come before you say, this is how you interact with this system, whether it's healthcare, this is how you interact with police officers, this is how you treat people when you're walking in a store, keep your hands by your side and try to look innocent instead of assuming that you're already innocent. So can you talk to me, Rashawn, just about the mental health component of things? Yeah, and what have been your interactions with the behavioral health sector of healthcare system?
That's a loaded question. I would start off with one of the things is, as Dr. Pulliam mentioned, it's entrenched in just the education system of how you train these individuals and these professionals. So as a therapist, what made me want to become a therapist is just my own lived experience with being diagnosed with bipolar disorder. I was actually drugged to the hospital by my family, and that was something that was traumatic for me because of the fact that when I got into the hospital, no one in there looked like me. Like none of the doctors, none of the nurses, none of that. So I didn't trust anybody in there. And when they gave me the diagnosis of bipolar disorder, I was like, and like, okay, I'm just trying to get out of here. And I don't believe what you're saying. And they didn't explain it to me in the best way. So they didn't put it on my level. They just gave me a bunch of clinical jargon that went over my head. And I was just like, all right, whatever. But then also you have those individuals that try to, push meds on you all the time, or they say you should go to therapy. And I was like, yo, I'm Black. We don't go to therapy. That's not something that we do. But having a Black male therapist was something that changed my life. But then also it allowed me to see therapy for a different light. But then also understanding that when I got the help that I needed, I was still ashamed of talking about my diagnosis, and it eventually led to 3 suicide attempts because I stopped treatment. And I was self-medicating with alcohol and all of those different things, but that's what led me to becoming a therapist. And when I got into school, I started to realize that the stuff that they teach you in school is not something that'll work in my hood. So that's what, made me want to challenge these things. And I'm challenging my professors. I'm like, how is this going to work? You telling me to sit there and ask these specific questions about something, and with a kid that I'm working with, and they got 3 or 4 brothers and sisters running around, mom is going to work and all of these things, and everything else is, how is this going to work?
Right.
So you got to involve the cultural aspect into it too. And a lot of times my teachers, they could not give me an answer. They was like, well, this is how it's taught. This is how it's done. Well, let's be real about it. That stuff is made for white people and made in a specific setting where people are going to come to your office and sit on your couch, and they're willing to be there, when a lot of times some of the people that I have to get them to involved in therapy first. And get them to trust that aspect first, and then I can start interacting with them with the different modalities. And it's still not going to look the same the way y'all try to teach it in the classroom, because we have to engage all of this other stuff. So I think that's one of the major things and then also understanding the research. So like the evidence-based practices and all of that stuff. If we don't have Black doctors out here and Black researchers out here conducting this research, we're not getting information about our people. We're basing all of this evidence-based stuff is based on white people. So right. And that's not going to always work with us. So, and then you can't have, and let's be real, if a white researcher goes into a Black community or a Hispanic community or a Latinx community, they're not going to get the information that we could get if they look like us. So it's so many different layers that go into those things when it comes down to addressing mental health care and in healthcare period in general. But to get back to your question about PTSD, yes, we all deal with some type of trauma and some type of stress, and just being Black in America or being brown in America comes with its own gripes and own things that we have to live with. At a very early age, I grew up in the South as well. My dad would tell me, you don't go to this side of the town. When you go into, even today as a 34-year-old Black man, I do not wear a hood in a store. Mm-hmm. I learned that at a very young age. And so certain things from a mental health standpoint, when are we able to be vulnerable? When are we able to really discuss all of the things that we have to do? Because when we step outside of our homes, we wear so many masks.
Wow. When we step outside of our home, we wear so many masks. It's one of those things. I agree with you. All these diplomas on the wall mean absolutely nothing compared to my lived life experience that you cannot learn from a book, right? And you brought up some very interesting points. Particularly, you talked about how race concordance, the therapist and the quote unquote patient, the person matching on these intersections, how it was particularly important for you. Why do you feel like it was so important when you had that Black male therapist? What was it that made the difference between him and a white female therapist that may have said the same exact words?
For one, some words I didn't have to say. It was understood. Like if I'm walking down the street and I see Cedric, if I see Cedric, I go like this, he already know what that means. You know, I don't have to explain certain stuff. If I try to lean in and dap him up, he doesn't have to, like, it's the understood, you know, cultural thing that we all have, that certain, even though we're not monolithic, yes, we're not, but certain stuff we can all relate to. But then also, I think one of the major things for my therapist was the fact that he was himself. He didn't have a suit and tie on. He had on a t-shirt, some basketball shorts, and some J's. And even me, when I went into his office, I was like, bro, you sure you a doctor? Because we don't see this. We don't see, like, even now when I show up as a therapist, I have a t-shirt on, that I'm gonna be comfortable.
Right.
I'm gonna be myself.
Right.
Because me being myself and my outward appearance, I got braids, and it's not going to stop what I know up here, and I can still help you out.
Right. They're not mutually exclusive, right?
Right.
That my authentic true self allows me to come in. If I am vulnerable with you and say, this is me, then you can also say, and this is me. You know, and definitely it brings up, you know, an interesting topic too, when we're talking about with the brown community, right? With the Latino community. There's a lot of intersections there that really played into COVID-19. And you even said, as far as colorism within the Hispanic community, we can also talk about immigration status within the Hispanic community, access versus vilification of persons. How does all of that shape you into being an advocate for that space? Like, what are the things that we really need to concentrate on as it pertains to the brown community versus the Black community?
I think there's so many bits and pieces of it. So I'm Puerto Rican, which it's funny the conversations I have with people, because if you don't know, Puerto Rico has been part of the United States since 1911.
Right.
And I've had conversations with people where they're like, and this is just like regular conversations, not speaking medically, like, oh, so do you have like a visa or something to be here? I'm like, no. First of all, I was born in New York. Second of all, Puerto Rico is part of the United States. So it's so funny how many little bits and pieces are just like, I have to, it really touched me when Rashawn was saying all the masks that you have to put on, because it's like the mask that you almost always have to wear in order to take things like with a grain of salt and not let them overwhelm you, is like, I'm here to educate. I'm here to educate. And that's always what helps me stay grounded in situations, because otherwise I'm just angry all the time. Like, why did I have to go through this? But there are situations where there are just implicit biases. And one such situation I can just only share from my own experience. But I have Crohn's disease, as I mentioned before, which is a bowel issue. It's inflammatory bowel disease. And as a woman with inflammatory bowel disease, there's a lot of intersections between OB or GYN care and Crohn's disease, because there are things that can happen that, especially since all your abdominal areas, like, wait a minute, I have a GYN condition and I also have Crohn's disease. I don't know where to go first. What I do know in this particular situation was, I do know that my GI is going to ask me, my gastroenterologist will ask me, did you see your GYN first? So my first stop is always, my GYN always gets me in quick. Let me call them first. I had been with this practice as a patient for 10 years. I delivered my son with their doctors. They brought on all new doctors. So they're like, hey, we don't have anybody you saw before, but we'll get you in with this other doctor. I walked through the door. Before I sit down, I was like, I don't know if it's an infection or if it's Crohn's related. Like, we got to figure this out. And as I'm expressing, this is what's happening, because I've learned to be extremely, like, to over explain, because as a patient, I'm sure Cedric can speak to that as well. But as a patient with inflammatory bowel disease, there's just always this assumption that not everybody knows how this works. So I'm going to have to do some explaining. Even if you have a medical degree, I've been living in my body and I know more about my disease because your degree is in a different specialty.
Right.
So I kind of like start my explanation process as I would with any doctor. And the comments that came out, like, it was very obvious that this particular doctor, I was seen as a patient in Connecticut at that time. She made a decision about me based on my last name on that folder before she ever came in the room. because she walked in and it was very obvious that she wasn't paying any attention to anything coming out of my mouth. And it was just like, well, what did you come here for? You're in some pain? Like, what? We don't give out pain meds. I'm like, I'm at an OBGYN's office. Obviously, I'm not looking for pain meds. And it's going to take 3 weeks for my GI to see me. So this is a logical first step. And it got to the point where I was just like, I literally stopped and I called her out on it, which is something that I think a lot of us don't do for fear of being that angry Black or brown person that's like, oh, you know, they're all like this, which happens a lot. And so I said, excuse me, I know what's going on in my body, but I'm not a doctor. I need you for your specialty to check me. I'm not asking you to do anything ridiculous. It takes 2 seconds for you to do a pelvic exam and do some swabs and do a test for something. Like, I'm not asking for the world. All I'm asking is for the same care you would give to anyone else. And if you can't provide that to me respectfully, then I would appreciate if you would leave and send in another doctor who can. At this point, she was very like flustered because she realized, oh, wait a minute, I got called out, which told me something. It told me that this wasn't her first time at the rodeo either. This is not her first time assigning blame to a patient because of their last name or color of their skin. And she did apologize. It was like a half apology, sent a nurse in who proceeded to do testing and all that thing. It turned out that I did have an infection and I was able to get treatment, but it wasn't enough to do that. And like Tamoria mentioned, you know, like you can always change doctors, but it's important that we don't just do that, that we hold the system accountable. So it was just as important me speaking to her personally as it was when I left that office to call and speak with the office manager and say, hey, I've been a patient here longer than she's been at this office. I was mistreated and she's the reason I'm leaving this office. This is what happened. Because sometimes we let that like sit with us and yes, we'll go see another doctor, or maybe some of us won't ever see another doctor. I mean, I have people in my very own family who, because they were mistreated, my, a family member who was pregnant as a teen and gave birth and was treated very badly by the OBGYNs at the hospital, and it was kept throwing in her face that she was like, you know, like a typical Hispanic woman, pregnant young and giving birth, never even bothered to check if she was already married. Like it wasn't that issue.
And that's not even an issue in itself either. There is no excuse for improper treatment.
You know, I'm just speaking from, you know, like 30 plus years ago, this is where people's minds go. And so this person in my family literally did not see an OBGYN again. From that point, I was from the time I was born until I was like 14 years old. They went all that time without seeing an OBGYN because of that experience. And unfortunately, that's what lots of people of color do. And all of us, whether it's because there's a language barrier or because we're afraid of mistreatment, it shouldn't happen. But the only way that we correct that, or one of the biggest ways rather, because obviously there's other ways, is if we hold the establishment accountable. That's not just me yelling at one single doctor. That's me calling back and making a formal complaint. That's me putting a complaint online. That's me following up and then leaving the practice and then saying, okay, now I'm going to go find care. Because if I had just stayed quiet and moved on to another doctor, God only knows what that woman would have continued doing to other patients of color.
Right. And it's one of those things I think about, you know, what Cedric spoke to as far as the system and what you're speaking to as far as accountability. As a medical provider, I truly feel it should not be the responsibility of a patient to hold the system accountable every time. You should be able to trust the system. And so how does the system hold the provider accountable? If there are multiple complaints, what has to happen? Because what we know is that, again, in that moment, I have a couple questions for you. When she made those comments to you, did your heart rate increase? Did you feel your heart racing? Did you feel
Without a doubt.
Right.
I felt my face starting to flush. I felt like, okay. And I'm already a person that struggles with, or that was struggling at the time with high blood pressure. So it's like, if I didn't have the presence of mind to stop and say something right there, it definitely would have been easier just to stay quiet and cower down and walk away, which is what a lot of people do. Because I'm going to argue with someone who has gone to medical school for 12 years. Like, they're not going to take me seriously, especially as a person of color. You're not going to take me seriously. That's what is ingrained in us.
Right. And it's one of those things when your heart rate changes, when you feel your heart rate going up, when you feel your blood pressure, you're literally, you can see your artery pounding out of your neck. When you feel your respiratory rate start to change, that means that your brain is telling your adrenal glands to release epinephrine, that you are now in a fight or flight situation. Yep. And for Debbie Lee and for Cedric, who are unfortunately dealing with IBD or inflammatory bowel disease, what's one of the things that makes your condition worse, if not stress, right? And chronic stress has not only been linked to inflammatory bowel disease, but also been linked to diabetes and hypertension or high blood pressure. It's also been linked to cancer formation and malignancy of cancers. It's also been linked to the fact that if a woman is chronically stressed before she gets pregnant, she is more likely to bury her child once she is pregnant before their first birthday. That's what chronic stress is not just some benign thing of, oh, my emotions are hurt. Emotions, mental health is physical health. And so we have to think about that. And Tamoria, you brought up as far as your lived life birth experience. How do you, when you go through something traumatic like that, for instance, before you went through your delivery in that 27 hours of giving birth to your beautiful daughter, did you know about the health inequities? And what are your thoughts now, again, how to change the system and address the system so that your children may be able to not see, hopefully, that we can fix this before they do?
So it is, a very interesting thing to live. At least a part of me every day does think about what happened, right? I'm a person who actually has felt my body losing life. And that is not something that one just gets over ever, truly. And as I mentioned before, shortly after, I was diagnosed with PTSD because I was replaying what happened. I would get in the shower and I was still, in a lot of pain. I was still bleeding a lot when I would go home and stuff. And I would just get in the shower and cry, just thinking, what just happened to me? And I had never heard of this happening to anybody. As far as I knew at that time, it hadn't happened to anyone in my family. When there were not a lot of resources, I would go online and just keep Googling things like embolization, hemorrhage, bleeding after birth. And the only resources that would come up were for women who were suffering with postpartum depression. Mm-hmm. And so depression is such a much different illness than PTSD. So I remember specifically one day, my OB, he called me to check on me. I had been home maybe 7 or 8 days at that point, and he called just to check on me. And just a natural reaction to someone asking, how are you doing? I literally said, fine. Meanwhile, I was sitting at the computer, I'll never forget, trying to nurse, still, in a lot of pain, could barely walk, bleeding, and Googling, right? And he said, no, really, how are you doing? And he said, describe to me what your days are like. And I started to explain how I wasn't sleeping, how I was just focused on trying to take care of my daughter. But I also told him about how I had developed this fear of leaving the house, how I just could only think about the blood, because everything for me it was like watching it live. When I was actually giving birth, there was a TV in the room, hoisted on the wall like we see in most rooms, and it was off, so I could actually see the reflection of everything that was happening to me that day. And so knowing what I know now, I go back, because people ask me all the time, what would you tell, that to Moria 11 years ago? And it's not really necessarily what I would tell her. It's sort of about, what would I want a physician and their staff to have available for every mother, right? So especially back then, when I entered most providers' offices, there was the only materials that were available were things about sort of what I call the happy-go-lucky aspects of childbirth. So Mommy and Me classes, Parents Magazine, that sort of stuff. And so I my husband and I joke, we spent a significant portion of that pregnancy, the first pregnancy, probably more focused on the stuff we needed, when really what we needed to prepare for was the stuff that no one was talking about, the possibilities, but that's the scary stuff. And so, you know, would I have wanted to know the statistics then? No, but who would want to know that? Because I have Black women that come up to me all the time now and say they're scared to give birth. And it breaks my heart because I actually didn't know the statistics until 3 years after I gave birth. I was writing an article and I was doing research for it. And that's actually the first time I saw the statistics. And I went, oh my gosh, I'm a statistic. I lived through this horrendous thing. And so for me, it's more about, again, what do we need to do collectively to help patients, to help them understand that not everything is going to go right, but that doesn't mean that it's all going to go wrong either, and that you or your baby are going to die in childbirth or in pregnancy. That there are things that we can be doing, that we need to be saying, that groups that we can be engaging with where we can get the information that we need. But also part of this collective responsibility involves other people besides patients and healthcare providers. It involves legislators, and it involves healthcare organizations as well, especially those who are charged with providing that post-professional training. So I know a lot of, so for maybe you, Dr. Hilton, Dr. Pulliam, even for Ranshawn, you know, I'm sure that there's opportunities for CEUs. Have you ever seen a CEU that involved maternal health in any way, in terms of both physical and mental, helping a patient cope with, you know, surviving a birth trauma? Have you ever seen any language around the bills that are written that are supposed to be focused on eliminating disparities in healthcare? And if not, that's a problem, because a lot of this work is done in silos where we have people who say, oh, we have this problem. Okay, I'm going to call a few doctors that sit on some boards and get people together and we'll write a bill about that. Or what we've seen a lot of in this last year or two, especially, which, you know, it's almost been infuriating to people in maternal health that COVID was sort of the catalyst for bringing to light all of the disparities in healthcare. Because, you know, for us, this has been, you know, for me, a decade-long journey, and for those before me, several decades long, of trying to bring awareness to this, right?
Right.
But okay, fine. The moment came, and all of a sudden, what did we see? Statements. That's what we saw.
Right. Right.
Seeing and reading statement after statement. Racism is a public health crisis. So I ask people this: name me one public health crisis that has been named by providers and legislators that people just put out a statement and then, okay, that was it. You know, usually anything that doesn't concern race, we see a lot more actions to follow. But when it comes to this, and the reason that we're in this situation is because there has been no, again, collective decision to say, yes, this is a public health crisis, and now we must make it mandatory, because we have declared a public health crisis. It must be mandatory that anyone who is charged with taking care of someone's health has to go through some training, culturally congruent training, anti-racism training, right? All these things. What people are comfortable with, especially right now, is the DEI terminology, diversity, equity, inclusion, when really that terminology should just be anti-racist. Let's be honest, right? Like it's like everyone's sort of dancing around it. Oh, we need, a board can be diverse, but if there's nobody on that board who's focused on being anti-racist, these issues, these disparities are going to continue to increase. There have to be people really focused on that, and also focused on, you know, I asked a friend this, I said, because I was trying to think of a good analogy, and I said, you know what, this is how I look at this. If I went to a cardiologist because I was having, like some heart issues, and they said, oh, you need surgery. However, I just haven't been trained, on how to do the heart, but I can, because technically I'm a cardiologist. Would you, do you feel like safe in that? So when it comes to, just because you have the title, if you haven't had all the training that you need, to do the job you're tasked with, you shouldn't be doing it. And what people don't understand is part of being a good provider is having anti-racism training and culturally humble training and cultural congruent training. And
Right.
if you recognize that you haven't had those things, but that's also part of the ego. The ego has to say, I am not there, or I'm not capable of that.
Right, because we know it does have consequence, right? And at the end
Right.
of the day, every provider has a responsibility
Right.
because you have someone's life in your hands, which brings me, to talk to you, Jessica. How do you, in knowing your life story, it's one thing to advocate for self when I know what's happening with my body and I'm an adult and I can tell you exactly what's wrong. But how do you advocate for a child, and how do you go against the system, particularly when we're talking about, neurosurgeons and brain surgeons? We know what type of characters typically go into certain specialties, no harm, no foul, but we know that there's personalities that are typically assigned to different groups. And the question is, how do you as a parent show up for your child? What does that look like? And can you just talk to us about, what is your life story?
It's hard to even figure out how to advocate because the distrust starts very early. For me, the distrust started when I was having an extremely painful pregnancy and I kept being sent home. The distrust started when I was in labor and trying to tell them I was in labor and I was sent home. The distrust came when I came to the emergency room screaming, crying, and still didn't get care. And my son's feet popped out of me in the middle of a triage, a 22-week baby that was 1 pound, and then pushed into a strange doctor's hands and had to beg them to resuscitate him. So unfortunately, I think sometimes people have this thought of special needs parents or African-American people as hostile or having these trust issues. And I don't think they realize this stems from childhood, and this for mothers stems from distrust. And the sad part is about being an advocate for yourself and for your child, and having a special needs child, and being an African-American woman that fits into a category. My category was, I looked very young at the time. Even though I was 30, I looked young, I was single. And there was this overwhelming approach to my son's care of, well, you don't want this baby anyway, right? And I did not know that was strange until my white friends would be at the hospital with me. I grew up in a white community, so I did not, I don't always pick up on things until my white friends are like, that's weird. No one's ever said that to me. I've never been turned away. I've never been asked that I want to keep my kid. The moment I took a pregnancy test and found out I was pregnant, I was handed options. I was very naive. I didn't know what Planned Parenthood was. I was sent there. Wow. And I had no idea. So what I want to say is that the first piece starts in really us feeling like our lives and our child's lives aren't valued. The second part of advocating that becomes frustrating is you feel like you have to work past this opinion that's already created about you in your chart. Like, for instance, in my chart, it took a Black doctor to point out to me that it said 22-weeker born to morbidly obese mother with no prenatal care, which wasn't true. I was a vegan. I was at the doctor every week. How did that get into my chart? Why was that in my chart? Why was that assumed about me? And then while I'm advocating for my child, I have a nurse pull me aside and say, hey, the reason why they're not really trying to fight for this with you is because we just had another Black single mother in this hospital that's predominantly white say, save my baby, and then she ended up giving the baby up for adoption. So there's there keeps being this talk of like, well, Jessica's like so-and-so, and the only correlation was Black. So I think the most disheartening part of this for me is that I did grow up privileged, you could say. And I, although have my Black skin, I still had a privilege to other Black women. And not only was I advocating for myself, but I was advocating for these other mothers, these girls that were younger than me, these girls that it was thought of, well, why do you want to keep your kids? You got 4 other kids, or, you know, stuff like coming, you know, the first question is, what's your Medicaid number? Or do you work? Or do you have custody of what? Like what? Like these are, and I would not notice these things until my white friends would be like, this is weird. Or take the Black and white out of it. My married friends, my Black married friends get treated better than me. There's levels to this. And then there's Black girls who get treated worse than me because of where they come from and because of how they articulate. So I think the most frustrating part is the undervaluing of our life to begin with. The assumption that because of my situation, because I'm not married, that me and his father don't want to fight for this. I mean, I've even had them send palliative care in over and over again and suggest things. And then the third thing I think is just insulting our intelligence. Literally how I caught them bald-faced lying to me was spending hours on WebMD and everywhere else. And they always tell you, don't go to WebMD. And we're like, no, we got trust issues. We got to go to WebMD. So I would say as a mother, and this is not a brag, this is just that I've lived in a hospital for the last 5 years of my life. Most of the time, I'm able to diagnose what's going on with my son before the doctors do. And it's this undermining of whatever, this single Black mama, we're not going to listen. And so many times I can figure out what's going on and I ask them to check it out and they will just push back. There's times where they've tried to send me home several times. One time they tried to send me home with broken hardware in my child's head. And the only reason why I found out is because I went to another ER the same day who did the scan and they showed me the picture and I went back and said, I know his reservoir is broken. I know you're lying to me. And I had a spreadsheet of, I then began to reach out to other mothers, other people in the Hydrocephalus Association, and found out about treatments that my doctor was doing and offering to kids just like Seth, and did the statistics from the Black mamas, the single mamas, and the married mamas, and the white mamas. And these white kids were getting treatments and these Black kids' heads were blowing up and they were dying and they were being denied autopsies. So I think it's an overall feeling, I think from the African-American community, and then I think people that aren't Black, but that have special needs kids, there's this, their life doesn't matter kind of fight. And, you know, they'll say stuff to you, well, he's gonna be like this, he's gonna be like this. Well, you don't know me. I grew up wanting to adopt special needs children. I was created for this. How are you gonna tell me that, well, you know, he's gonna be happy, you're gonna have to live, he's not gonna, I didn't ask you that.
Right.
That he has value and he has a reason to be here, and I'm going to advocate for that. So it's hard to advocate for a life that medical professionals don't deem valuable.
Be valued. Wow. You know, your story reminds me, the reason why I went into medicine, when I was 8 years old, my little sister asked my mom if we could have a brother. And it was at that time that she told us that when she was 17 years old, my parents' first child was actually a little boy. She was 6 months pregnant. They went to a clinic to get their prenatal checkups and they did a test. She felt a sharp pain. And from that day forward, she started leaking fluid. And she called the clinic and said, similar to you, hey, I'm leaking fluid. Is this normal? This is my first pregnancy. I don't know what's going on. And they told her, everything is fine. You're going to be okay. And within 2 or 3 days, she went into labor. And unfortunately, my little brother has a different story than your beautiful little boy, in that he only lived for 3 days before passing away. And so I take that to heart. One of the things you say is that we're not listening, right? That there is no excuse for a provider hearing your story and not saying, why is she having pain? Have we checked to make sure she's not in preterm labor? Have we checked, you know, and so when you're, again, when you're talking about even the intersection of race and ethnicity and the healthcare system, and you add on to that the extra layer of someone with special needs who cannot speak, when we talk about accountability, what does accountability look like to you?
Yeah. So, as mothers, we always have to kind of go in and brief. A really important thing is briefing the staff and briefing everyone who will listen about the signs that your child are in pain. But again, there's this thought that sometimes that we can withhold more pain. There have been times where looking at the numbers on my child's monitor, he's clearly in pain, he's scrunching, blah, 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 blah. But it's always like, well, why are we holding out giving a painkiller to a baby whose heart rate is 200 and scrunching? Do you know what I mean? So for other mothers in my position, I would say a few things. One, you have to connect with a network of women or men or couples or parents like you. You're gonna need a crash course. It's a whole crash course. Your life has changed. You will not be able to navigate this unless you have tons of time to dedicate to research, or you have a community. So you need to connect with a community of people who can tell you how to advocate for your child. When someone is nonverbal, you have to study them like crazy. And there are little nuances. I mean, as a mom, I could see the way my child blink his eyes and be like, okay. And in about 10 minutes, he's gonna have a seizure. You know what I mean? And so when you have home care nursing and you have doctors and you have physical therapists and you have, the list of OTs and everything we go to, you have to, I type it out, but you have to just, we always have somebody around the clock in the hospital with him, but say just for any reason I'm in the bathroom, whatever, I have it taped on the hospital bed, all of the signs that he could be in pain, the steps that you take before you give pain medicine, try this, try this, try this, try that, try that. But I think people who do not have special needs children would be surprised at how much they communicate. They're always talking. They may not walk, but they're walking. They may not have a job, but they have a purpose. And so I think when regular people, quote unquote, see special needs people, they're like, and they're all nervous and they're all scared. And, I remember giving the awkward high before I did. I'm not judging anybody. But when you're actually the parent, they're just your child, and you learn to communicate with them. And it's not awkward for anybody else but you. Like the mom, I'm not, this is my kid, he ain't got no fingers on his right hand and he's gonna pound the air. We're gonna, So I think it's just about studying your child, documenting everything that is important regarding your child's needs, connecting to a community, and being vigilant.
Right. And you bring up a couple things you brought up. For one, and there were other people who said the same thing. You grew up in a predominantly white community, right? And we know, unfortunately, historically, that even with redlining, that money literally follows, resources literally follows the racial lines, right? And we know that Black and brown communities, you're twice as likely to not have a hospital if you're in a predominantly Black or brown community. You're 4 times as likely not to have a grocery store, something that should be as simple if you're in a Black and brown community. That 70% of all pharmacies are literally in predominantly white communities, right? So you growing up, Jessica, in that environment has, in ways, like as you said, was a very privileged position. Timoria, you also mentioned the fact that these healthcare statistics you weren't aware of. Rashawn, you mentioned the fact that your family literally took you to go and have some interventions on behavioral health. So what are some advice that you all have that if you are in a community that those resources are not available? We've heard mention of WebMD, and this is a way you can advocate and look and search. What are some other things for persons seeking help in the healthcare space that you would offer up as a way to help guide them towards their safety?
Well, I think one of the mistakes that we tend to make is, again, around access. I think we think that everyone has access to things like we're using right now, right? Like Zoom and iPhones and all these things. And what a lot of advocates that I work with and who I know across the country feel like that actually is the best way to advocate. It's boots on the ground. It's literally walking in to the community healthcare center of the actual place where the people who need the help are, right? The people who you're failing to see get help, the people who we know the disparities are hitting the hardest, literally walking in and saying, this is who I am, this is what I do, or this is the org I represent. Here's information in your language. Here's, phone numbers that you can call and speak to someone who speaks your language, who understands your culture. I may not be that person. Sometimes I am, sometimes I'm not. And again, that's being culturally humble and saying, although I am a historically marginalized person, an individual of that group, it doesn't mean that I can walk into Debbie Lee's neighborhood and understand it, right? Right. So it's up to me as an advocate, right, in healthcare in general, to say, although I don't represent you, I'm not in your community, I have access to these resources, and I just want you to be able to have them too. And that seems to actually be one of the trickiest pieces. It seems like it should be so easy, right? It seems like any group of med students should be able to do this, legislators, right? All these people should be able to do it. But one thing I hear all the time is fear. And I'm just going to be super honest. It's the fear of actually walking into a Black or Latino community, a community that's foreign to you. It really is, to me, one of the biggest contributors to why people lack access to the help. And one thing, as Jessica was talking, I was thinking of, and it's a question that it's something that I actually thought more recently about in terms of my experience. I don't know if it was like a year or two ago, I started thinking, did anybody ever even ask me if I needed help, right? So I started sort of thinking about, who were the people that visited me in the room for both pregnancies, right? And at no time, now after I had almost died giving birth, not at any time did a social worker come and speak to me about my experience. Did anybody suggest a mental health professional? It was doctors and nurses and then, the cleaning crew and all that. But there was never a person who walked in the room saying, you just went through something horrendous and we need to acknowledge that, and how can I help you? And I bring this up because I recently was in a meeting, and there was a hospital here, and there was a presentation in the meeting, and there was a social worker giving a presentation about how many women she had given mental health resources to for the year. So she said, out of 4,000 births at this hospital, I gave 538 women mental health services this year. So everyone was like, wow, that's amazing. That's great. So she actually put up on the screen who, what that demographic was. And it was majority. And when I say majority, I mean 99.9% white women and 0 Blacks. So I'm sort of, if you're probably getting to know my personality as we talk, but I'm no wallflower. So of course I'm sitting there and I'm kind of stewing, and I say, I don't understand how you can actually be proud of this. If there's anything in terms of research, if this was the research that I got back at the end of a year's worth of work, and I looked at that and said, oh my goodness, I'm a white provider at a hospital with a demographic where at least 4% of the population that gives birth is Black, and I provided no mental health services for Black birthing women. There's something that I'm doing wrong. Then this is the problem. And to be proud that you didn't provide any help for people other than white women. That's the problem.
That's the problem. And who, Cedric, who do you think should take the lead in addressing these changes? Should it be the individual? Should it be public health advocates? Or should it be persons within the clinical space, within the hospital system itself? Like, who takes the charge of righting the wrongs of these disparities?
The charge is taken by all levels. And right now, one of the biggest things that, I'm at the Department of Health and Human Services, or HHS now. I just started on Monday. But, one of the major aspects of this is, looking at racial equity. That executive order signed January 21st requires all federal agencies, and HHS specifically is really diving hard into what does this mean for us, and what do we need to be looking at in the sense of how do we correct these systemic racist issues. This is very implicit bias that directly happens to clients at all levels, from the Black community, Latinx or Latino community, and even Asian Pacific Islanders, et cetera. Immigration or immigrants or refugees all see this very vivid picture of implicit bias once they enter in the healthcare system. And so the clinical staff, the sites that we fund, et cetera, hospitals, everybody to the janitor, to the front desk manager, to the case managers, and to up to the doctor and the prescribing physicians, all have to be held accountable, all have to be trained, and all have to adhere to ensuring that they complete anti-racist, or whatever we're going to call this, because Tamara, you're right. DEI is the term they keep using, but it's really anti-racism training and cultural competency training. Dually, they both need to be had for all levels of every single level. So the local, county, and the state health departments as well, their state government employees, they also have to be held accountable on this, and they have to charge. And if their leadership is not ready, they need to go. And that's the realities that, if you are not ready and you got all these demerits on your license because you've had all these complaints, because as a patient, if I encounter something with you, guess what? I am going to contact whomever you're licensed with, because I have to keep my license as a health psychologist. And I must ensure to treat every single patient that I see equitably, just as if I was that patient, right? And so if I encounter you, I don't care if you're my dentist, if I encounter issues, I'm reporting you to your board licensure association. And that is tracked on their record. Just like if we're looking at high school records, how we used to always get told behave in school. Mm-hmm. That is a very important thing. Lawyers, doctors, you name it, that's important. And so, I behoove, patients, and when I speak with other IBD patients, or when I speak to patient advocates, like, that is your right as a patient to report them. Just like if you're leaving, make sure you report. Just like if we have bad business experience, we're going to report them to the BBB or the Better Business Bureau. And so, like, we have to think in that mantra to hold them accountable, because they lose their license, they no longer can legally practice. And so if they do practice, then the next step is they are going to see, consequences greater than just losing their license, like jail or whatever. Not to say that I support the carceral system, but these are things that we as patients have the ability to have that power, because they, as a doctor, feel that they have the power, when actuality, the patient should hold that power all the time throughout the entire journey of your experience with that patient. Right. And so at all levels, that charge is here, and it has to be centered in all of the work we do in the health space, regardless of what we do. I don't care if you're the data input person, you have to also be a part of that as well. So every single person that touches and is doing the work with patients and the lives of individuals, if they're not willing to do it, find a new field and do something else. And that's how strongly I feel as a health professional myself, a medical professional, to say, if you're not in it to be equitable, you need to get out of it.
Jessica, you have anything to add to that?
I would love to speak to this. So I love what Cedric is saying. And he's basically saying to speak up. And I do want to tackle, though, the very fact that it is absolutely terrifying to do that. And it's way easier said than done. So I think the first step is conquering your fear. I know for myself, I was super afraid because I didn't know if I would get blackballed by calling people out. A video of me and my son went viral, and we started to get horrible treatment from the hospital that he was at when that video went viral, of them not resuscitating him when he coded. And at first, the hospital staff got super involved and were all like working with me. We were talking about launching organizations. We were talking about doing racial bias training and all these different things. And once they saw the news story kind of die down, they cut me off, did not speak to me anymore. And they started treating me like a criminal, to the fact that I had to switch hospitals because they were trying to catch me on anything they could. So I think the one is just conquering fear. The second part, I think, is you ask who is Ebony, you asked who are the people that need to help. It always needs to flow from top to bottom. Yes, we all need to get our boots on the ground, but I realize that in my position, I've got to help the women who don't understand what I understand. Then I need the people above me to help me, because it is all of our personal responsibility to help whoever the underdog is. The third thing I will agree with Tamora about is mental health, to the point where my son and I started a nonprofit. It's called Love to Life Foundation. And what we do is we give free therapy to anyone who has terminally ill or special needs children. And that is because, to her point, you have people that come to the hospital to feed you. You have Ronald McDonald houses to sleep in. You get basic needs, but you're going crazy. You have PTSD, you're afraid of dying, you're afraid of your child dying, you're afraid you're being followed by, you start to get paranoid and scared, and then you can't do basic things like go to the bank. Checking mail is stressful because you're keeping someone alive every day. So, and I want to say quickly, the right mental health, because I remember when we ended up moving my son to another hospital in the inner city, great hospital, but they did this mental health thing. They wanted me to go to Miss Burnside. You're like, because before I put them on blast, I was the mother they looked to. Oh, she's the intelligent Black woman. We love her. She's, whatever. So I remember I go into this room and they have this therapy thing, and bless their heart, but this is people who, one of the parents doesn't have an arm because he was in a gang, and then somebody else, like, these people don't have homes, right? And so these therapists are like, so what do you do for self-care?
Right.
And like all it's so culturally off. And so I think the huge deal is we need some laws in place, because why does this inner city hospital have 2 Black nurses in the entire PICU? Why are the only Black people working here in the cafeteria, at the front desk, and doing the security?
Mm-hmm. Right.
I need people who understand this culture, this city, working here. And everyone needs to go through racial bias training. So I agree with all my counterparts, but I think the biggest thing is, when you know your heart's in the right place, trust yourself, believe yourself, because I wanted to be what we would call a good slave. I know this is wrong. I know this is evil, but I'm scared for my life. So I'm not going to speak up, and I'm going to pretend this racism and this blatant discrimination isn't happening. And I've done that my whole life living in a white community. I don't want to offend you by telling you how you treating me like dirt. And so we have to conquer that fear. And we do have to prioritize mental health, because you can't do anything. So connect with us, Love to Life Foundation, if you're in need of therapy or resources. We do grants. We help you start businesses. We do bridge housing if you lose your job in this process. But I know my team is here to help any parents in this position.
That's fantastic. It's one of those things, when you say speak up, we do kind of shy away. But one of the things I'm so vocal about racial health disparities, even at standing up to the system that I belong a part to, because I know I match the demographic of the person's more likely to die anyway. So me staying silent does nothing to benefit my people, does nothing to benefit me. So right is right and wrong is wrong. And how do we speak to that? And when we're talking about accountability, Cedric, Jessica, Tamoria, you all mentioned mental health. Rashawn, help me. What metric, if we're talking about birth outcomes, I can measure who lives or dies as far as mothers. We're talking about children, right? And we're talking about blood clots and opioids and how pain is being treated. Those are very objective findings that have a number tied to it. Mental health, how do we make sure, what metric, how can we hold accountability in that space that we know is so incredibly important?
Well, recently we started to see the real metric that people wanted to all hone on is the suicide rates. And understanding that, a lot of our kids, and especially Black males, are, dying by suicide. And so that's one of the metrics, but we don't want to just depend on that.
It's too late,
understanding, right? It's too late then. But we also have to understand that, a lot of times, a lot of our kids are misdiagnosed. Or dealing with so many things, whether that's dealing with ADHD, misdiagnosing them with ODD, oppositional defiant disorder, all of those particular things. But I would say one of the major metrics is understanding that mental health and mental illness is something that impacts us all, no matter if you have a diagnosis or not. That's the point blank period. There's no other metric that we need to focus on. everybody needs some type of help. And then understanding that therapy looks different for different people. It's not you sitting on the couch all the time. It could be Reiki. It could be, drum circles. It could be, especially for people of color, it could look very different, but we also have to give those resources to these people.
Right. And, and Debbie Lee, with your recount of PCOS and IBD and SVT and all these different providers that you have to go and connect with, which makes it even more likely that you're going to encounter someone who treats you in the way that you do. How do you think the healthcare system needs to even change its approach of being so siloed that I have to be as literate as a physician in order to navigate it in the first place, right? Yeah.
I think, no, that's a really great question. I think from my personal experience, I went from living in Connecticut where I had doctors that were like very separate, to moving to Tennessee. One of the main reasons that I relocated was because there's an inflammatory bowel disease center here is part of a major hospital network. So that was like one of my family's big things. Because my husband was like, look, we can't, it's been too long of you being too sick. We need help. Our son needs you, and so thankfully he was able to, he was able to prioritize that as well. But there was such a huge difference just from one place to another, because there was communication happening, which is phenomenal. It's just regular communication, which you would think, oh, that's pretty easy, right? But it's amazing how used to we get to that not happening, right? Like I had a doctor that was when I was living in Connecticut, one of the top gastroenterologists in Connecticut, because I sought that out. I said, okay, no, I want to see a good one. Like, I don't want to just see anybody. And he was a great doctor, absolutely wonderful. But I had to remind him every time I came to the office, oh, you must be doing okay because you've gained some weight. I have PCOS. One of the symptoms of that is weight gain. And then you put me on medication that makes me gain weight for the Crohn's disease. So no, I'm not okay. Like I had to continue like every single visit, that's every 3 to 6 months, reminding you not to look at my weight as a symbol of, versus now in a different setting where I have doctors that are talking to each other, where I went and saw my gastroenterologist and said, hey, look, I have a lot of health issues that are related to my weight. I've done everything possible to lose weight. What can I do now? Because I need to do something safely. And they're like, you know what? We're going to talk to this doctor. Normally they don't see patients like you, but we're going to go ahead and make that effort to make sure you make the connection. He also sees our patients for other things, and they made that happen for me. But even in that process, it's understanding that there has to be communication, not just the patient to the doctor, but one doctor to another doctor, to say, hey, guess what? I'm not going to wash my hands of this because you're not in my field. I'm going to take responsibility, because if you saw me one time or if you saw me 20 times, you're still my patient.
Right.
And I'm pleased to have had that experience here in Tennessee, which is absolutely ridiculous, because being from the Northeast, one of the big concerns that was made to my family when we made the decision to move is like, oh my gosh, but people are racist down there and you're not going to get good treatment. And so it was crazy to me coming here, of course, with that in the back of my mind, because I have a Black son and a Black husband and I'm brown myself, like this is going to be a problem. And I've come against a few things, but just that communication. And I think one big piece that helps that is the fact that I'm communicating, because sometimes as patients, we put all the onus on a doctor and say, no, it's the doctor's responsibility to do everything. But guess what? A mental health professional, a doctor, whether it's a GI, an OB, you can't help me if I'm not giving you full information. And to be honest, our community is almost taught, don't give full information. Like my mom, oh no, don't talk to the doctors about that because that's private. Like it has nothing to do. No, my OB history has everything to do with my GI history. Right. Because again, as you mentioned earlier, Dr. Ebony, there's that intersection of IBD and stress, and anything in my life that's a physical issue can become a mental health issue.
Completely. You know, you bring up a number of different interesting points. For one, that racism lives everywhere. In fact, there was a time period that in Maine had the highest racial health disparities in terms of COVID-19. And we know the demographic that lives in Maine, right? You brought up another interesting topic of, again, communication being key. Instead of the physician telling you how you feel, it could have simply been, instead of you must be doing great, it could have been, how are you doing? And having that open-ended conversation can really help to change the narrative and outcomes tremendously. You know, Rashawn, you know, I tell me about this organization you have, Eustress. What exactly is this organization? And for persons who may not live nearby you in Charlotte, how can they get in touch? What are some resources you can make available? Yeah, let us know.
So Eustress was something that a nonprofit that I started back in 2013 to raise awareness in Black and brown communities for us to be able to talk about these issues. I host mental health awareness walks. I've been doing them now for going on 7 years. I host 3 a year, but then also I do adult coloring nights. So to show people that therapy, like I said, therapy doesn't always look the same. And you can also implement different stuff into your daily lifestyle that can help boost mental wellness in your day-to-day life. So when I do these adult coloring nights, I just have adults come in and we just kick it. We have music going, we're coloring, and that's something that you can do on a daily basis. You can even do it with your family. I also started, since COVID happened, I started doing them virtually. So anybody across the country can tap into those. Also, we do similar to Jessica, we do therapy sessions for individuals that can't afford it. So last year we were able to supplement 1,400 therapy sessions for individuals across the nation, and especially Black males, because I have an affinity for Black males when it comes down to getting that help, because I want them to have that communication to be able to address their issues. Also, I do scholarships for Black men that are pursuing their degree to become a therapist, because we don't have enough Black male therapists out here. So this year alone, we gave away 6 scholarships to 6 males that are pursuing their degree in counseling, social work, and psychiatry. Just to get them, because that's another barrier. Like we said, the system is structured for us to suffer. So we got to, get more Black people, especially Black males, into the school system to be able to learn this, but then also to be able to challenge the school system as how they're being taught. Also doing paid internships for those that are becoming therapists as well. Because like I said, some of the stuff I didn't learn in school. I had to learn it on my own and just through my own lived experience. So like with Eustress, we're doing a lot of different work when it comes down here to helping our individuals in our communities, also providing them resources to get in contact with just different therapists across the nation, and then just the different work that we're able to do. So definitely feel free, if you can spell my name, you can find it. And then because we do a lot of work just even on social media and all of those things, just connecting the dots and giving people practical stuff that you can implement, because everybody doesn't have access to therapy services. So, but then you can still address your mental health even if you don't have a therapist right there in your own hood.
Well, if you're going to Google it, Eustress is spelled EUSTRESS. It's an incredible organization. And I think just in closing, you guys, if you can give a one sentence answer to either address the individuals, the community, or the system itself, how would you say, what advice would you give? Let's start with you, Debbie Lee. What is the advice?
I think the advice I would give is just to always be completely open and transparent. I think a lot of us just hold back so much. And when you hold back, you're never going to get the care you need. Yes, someone might have a negative opinion about you. Someone may treat you badly, but you're never going to know what could happen unless you're willing to open your mouth and say something.
Good. So vulnerability can save your life. How about you, Timoria?
The most important message that I have for patients is that they deserve to be treated with dignity. And that there are providers who look like them, who speak their language. These people are out there. It does sometimes take work to find them, but they do exist, and you don't have to settle. It's stressful. I'm not gonna, sugarcoat that part of it, that it is stressful when you receive, really bad healthcare or treatment from a provider. But what's worse is letting that abusive behavior continue. Take charge of your health care for yourself and for your family. Make it a family effort to take care of each other as well. I think that we as adults, our children look up to us as role models in every way. And one of the most important things we can give our children is the education of what it feels like to have dignity, to have self-worth, to have good self-esteem.
Yeah, because their life matters.
Right. And if
Right.
you have good health, chances are those other things won't fall into place for you either. So it really starts there. So that's, yeah.
Good. And how about you, Jessica? What one piece of advice?
Yeah, I was going to say something similar to what you guys just said, that I would say to anyone who would come to me is the first thing I would want them to know is that you are worth the fight. You are worthy of love, life, health, and respect. And I think just going into the journey, never forgetting that it is your human right to have respect and good care. And you're worth fighting for yourself, and you're worth fighting for your family.
Cedric, anything to add to the system and community? What advice?
Yes, every day I do the work as a federal employee to bring voice to the voiceless and also bring them to the table, not just at the last part, but the beginning stages of the process. And I think that's so vitally important of inclusion, of ensuring that equity does actually exist in our reality. And it's just not something that we're putting on paper. And my role as a member of community, I still show up on the boots on the ground, the testing, the community events prior to COVID, not right now, of course, but I always, the 13 years of working in this space, have always did that and make sure to stay in tune and to be abreast of what is going on in the community so that I'm just not preaching to, these policy folks that, don't even know what community does or what is going on a daily basis. And so that's my message, is just staying in tune. And this is for the folks that are maybe the medical professionals that are listening to this, stay in tune, stay tapped in. And if you are not, make sure that, you're doing something, whether it's your team or someone that, reports to you that really has some of that like touch point with community, because that right there brings in some of the equity and inequity and disparity issues to be able to understand how to make your practice better.
That's perfect. And Rashawn, wrap us up. What do you think?
I would say with everything that we said, and instead of not just depending on the system, like Cedric said, let's make this a community thing. And just like my shirt says, it says check on your friend. And with checking on your friend, you can be an advocate for so many people. You can be an advocate for people in your family. You can be an advocate for people that you don't even know. So it's just as simple as, reaching out, checking in on people, and then, showing people that you really care. Be a human. And once you be a human, that's a ripple effect. And then it'll spill over to so many other things.
I think you guys, I can't thank you enough. If I was going to wrap it up, you literally said, as patients in Black and Brown communities, just as individuals, we wear multiple masks, right? But that we are worthy, as we said with Moria and Jessica and Debbie Lee, we're worthy of being able to be vulnerable and present as our true selves. And that if we take the words of Cedric and Rashawn and look at the medical providers to listen to the patient's voice, that if we try to pursue this equity and push that towards that of health justice, that we can be in tune to the beat of the community, and we can all really just live a healthier, happier life together. So I thank you all for joining us. I thank you, ShareCare, for allowing us to have this space to really try to speak to the individual, the community, and the healthcare systems. How do we play into these disparities, and how can we fix it? Until next time, it's great seeing you.